My name is Anil Lalwani. I am professor and vice chair for research in otolaryngology, head and neck surgery at Columbia University Medical Center in New York City. I've been practicing for about 25 years in all aspects of otology and neurotology. So in the past, when I first started practicing in the 1990s, we implanted only people that are profoundly deaf. And I have to admit, the outcomes were quite mixed because, first of all, they've been deaf for quite some time. You didn't know whether they had auditory neurons left to stimulate. And as the outcome with cochlear implants became much more reliable, we have moved to implanting people that have residual hearing because we know they're going to do better with a cochlear implant than a hearing aid. So I think the outcomes have become much more predictable now because we know they have auditory neurons. We need auditory neurons for stimulation for a cochlear implant. So in general, the patient outcomes are much better. And in turn, because we're implanting younger patients as well, there's a greater impact on their life and quality of life as well as their professional goals. We recently published a paper in people that were 80 and older. We looked at their hearing and gave them some test of their cognition. And what we found was there's a direct correlation between hearing loss and cognitive decline. What was really interesting is that those individuals that wore hearing aids, their cognitive function was better even though their hearing loss was worse. Hearing loss associated with cognitive decline, but worse hearing associated with better cognition because they wore hearing aids. So intervention leads to mitigation of some of the consequences, especially cognition in this case. We've also looked at brain volume in people 80 and older. We found a direct relationship between age and whole brain atrophy, but not temporal lobe atrophy. In contrast, we found a relationship between hearing loss and loss of temporal lobe atrophy, the lobe that's responsible for hearing, but not whole brain atrophy. More importantly, we now have some evidence, not yet published, but we now have some evidence that the use of hearing aids leads to preservation of that brain volume that you would otherwise lose if you didn't treat the hearing loss. So cognitive decline, brain volume loss are really a couple of very good reasons for earlier intervention.